Here are 3 USMLE-style questions focused on the celiac lymph nodes, their drainage, liver, stomach, spleen, pancreas, upper duodenum, and associated pathologies like mesenteric lymphadenitis, inflammatory bowel disease, and celiac disease. Question 1. A 7-year-old boy presents with fever and abdominal pain localized to the right lower quadrant. Ultrasound shows enlarged mesenteric lymph nodes without signs of appendicitis. Which of the following is the most likely diagnosis? A. Celiac disease. B. Inflammatory bowel disease. C. Mesenteric lymphadenitis. D. Intussusception. E. Volvulus. Correct answer, C. Mesenteric lymphadenitis. Mesenteric lymphadenitis is a common mimic of appendicitis in children, presenting with RLQ pain, fever, and enlarged mesenteric lymph nodes. Why not the others? A celiac disease equals chronic diarrhea and malabsorption, not acute RLQ pain. B. IBD equals chronic symptoms, often bloody diarrhea. D. Intussusception colicky pain, often with current jelly stools. E. Volvulus sudden onset with bilious vomiting and signs of obstruction. Question 2. A 45-year-old woman with chronic diarrhea, bloating, and weight loss is found to have villus atrophy on small bowel biopsy. Serology is positive for anti-TTG IgA. Which lymph node group drains the affected portion of her bowel? A. Inguinal. B. Celiac. C. Superior mesenteric. D. Inferior mesenteric. E. Internal iliac. Correct answer? Celiac. Celiac disease affects the proximal small intestine, especially the duodenum, which is drained by the celiac lymph nodes. Why not the others? A. Inguinal external genitalia lower limbs. C. Superior mesenteric jejunum, ilium, right colon. D. Inferior mesenteric equals descending colon, sigmoid. E. Internal iliac equals pelvic organs. Question 3. A 60-year-old man with a history of weight loss and epigastric pain undergoes endoscopy revealing a mass in the stomach near the lesser curvature. Biopsy confirms adenocarcinoma. Which lymph node group is most likely involved first? A. Axillary. B. Superior mesenteric. C. Inferior mesenteric. D. Celiac. E. Correct answer, D. Celiac. The celiac lymph nodes drain the stomach, liver, spleen, pancreas, and upper duodenum, making them the first group involved in gastric cancer metastasis. Why not the others? A. Axillary upper limb, chest wall. B. C. Mesenteric nodes equals intestines. E. Paraortic downstream from celiac, later involvement.